Hey everybody, good afternoon. Dr. Erickson, EHS Physical Therapy and Chiropractic. Also, your herniated disc expert with the Herniated Disc Fix program to help you get back to doing all the things you want to be able to do. And
Yeah, Dr. Jake Anderson here with Essential Motion Spine and Sport. So today we're going to be talking about inflammation. Is it bad? Is it good? When are meds involved? When should we take them? We'll talk a little bit about pain and then failing chiropractic or physical therapy.
Yeah.
So let's dive into inflammation first, Chris. We know it's a requirement. It's natural. It's a process that needs to happen. When we're talking specifically about herniated discs, we definitely need the inflammatory process to kind of take its toll, run through the whole gamut, and that's how we heal in the end. So why is inflammation important? Why do we need it?
so that in that process as it happens, so when you talk about with the herniated disc, your body recognizes that something is wrong in that area. It's recognizing that there's a piece of tissue that is in a space or in an area that it doesn't belong in.
Yep.
Especially if it was an acute type thing where maybe you were like you did when you were lifting, there's an immediate pain response, knowing that there could have been maybe some tearing to that annular wall, or even if it's still enveloped within the annular wall, it's just bulged kind of into that area. Your body will recognize that, will make you stop because of the pain, and it'll send an inflammatory response to the area. The reason for that is to initiate that healing process. So the inflammatory process is the first phase. Then as that kind of subsides, you need that because it kind of brings down some of these little guys that come down and start eating up some of the tissue that's in the way. It brings down and starts the process of the next phase, which would be like the remodeling phase with some fibrinogen, some scar tissue formation, but it's part of the healing phases.
Yep. So once that process takes place, that can kind of eliminate either the nucleus or the discal material, can eat that out, so we can start, rebuilding our tissues, rebuilding our tolerance to movements. Medications, we get questions on this all the time. As chiropractors and physical therapists, we don't prescribe medications, but a lot of people need or want that quick pain relief.
Yep.
So medications can play a role in the healing process. A lot of people just take simple, over-the-counter ibuprofen, Tylenol, whatever it may be, just to knock the edge off the pain. Some of those anti-inflammatories, though, can slow or delay that inflammatory process from occurring. So it's a little bit of a risk-reward thing. Like, you need that to play out so those macrophages can come in and eat that material up. You don't want to completely block that off from happening. Otherwise, you'll never start to feel better, and you need that scar tissue to form.
Yeah.
But you do need to function and still continue to live life. So if you need medications to kind of knock the edge off, there's nothing wrong with that. But ultimately, you want that inflammatory process to play out. So we said we were going to talk about some pain too. Yeah. Pain, it's important to understand.
I just wanted to go through the chemical irritation of the inflammatory process.
Yeah.
Would be a constant pain.
Okay. Yeah.
So that's where it's kind of tricky to determine, is that pain coming from inflammatory response and process, or is that constant pain still a mechanical? Great and point. Sometimes we do need to bring in a strong anti-inflammatory to kind of shrink things down, and like an injection into the back with a corticosteroid into that disc space to help shrink down that tissue that's just, it's not calming down. So there are times when inflammatory then is too much for too long.
Yeah, so we fight mechanical pain with movement. We fight chemical pain with chemicals, drugs.
Yeah.
Pain in and of itself, you're going to have pain from a herniated disc. I mean, no matter what, it's going to produce pain, and it's not going to be fun for a little bit. But usually we can alter those with movements, and it's important. A lot of people equate pain with I'm injuring myself more, I'm damaging something, I'm tearing something, I need to stop completely. And it's important to understand that a production of pain does not necessarily mean that you should not be doing something, or that you should be altering it completely. So during the rehab process, Chris, you can probably talk more to this since you do a lot of spine rehab stuff.
Yeah.
Sometimes it's necessary to produce pain to get a good end result.
Mm-hmm. So the healing, when we talked about, now we're through the inflammatory, process, and more in the healing and the remodeling phase. There needs to be, sometimes we move into an end range or we explore these different loads. So Jake talked about different movements, and it could be a matter of position, of load, of time of day, end range, testing. So those things will create pain, but knowing where it is in the body. Is it centrally located just in the spine? Does it go further down into a leg or further down into an arm? That's important. How long does it last? Is it increased and then it's no worse? Does it produce a symptom that wasn't there and then it quickly goes away? Does it feel better for like temporary? Okay, I bring my knees to my chest. Ooh, that feels better at the time. But then when I stop, actually it's no better because the pain comes back to where it was. So all those things play into the assessment part of the process to know what is the right things to give you. So if you purely just went off of, well, if it hurts, don't do it, you'd never really figure out what movements, end ranges, loads, things you actually need to do to work into to help. Because there are definitely times, not always, but there are definitely times when moving to a specific end range or movement will increase, a pain you already have. Yeah, or it will produce a pain that wasn't there. But then the net result when you're done, after you do so many reps, 8, 10, 12, 20, 30, whatever it is, and it hurts every time you do it. So it's like, oh, I don't like this. This is not, I shouldn't be doing this. But then if you have the right coach, the right guidance, practitioner, clinician, then when you're done, and let's say you stand back up, walk around, or you retest things, you move your neck, you look up or down, move your arm, all of a sudden it's, that's a lot better. It's better than it was. So then the net is improved. Well, then the pain is obviously worth it. It's worth moving into that, knowing the end result is an improvement overall. Now, that's again part of the process. So there are times when we test those movements and end ranges and things. Okay, well it hurt. Okay, go do this thing, retest it again. No, that actually is a little bit worse. Okay, that's okay. We know that now. But we wouldn't have known that until you actually tried it. Now we can change it. We can mark that off the list and say we need to move on to something different.
So we can dive in here. That might be where a lot of people say, "Oh, I've failed chiropractic.
Yeah.
Oh, I've failed physical therapy," because they had that initial worsening, or during some sort of the process, they have that increase in pain. They're like, "Oh, shoot, I'm done.
Yep.
This isn't helping. I'm getting worse."
Yeah.
You got to remember, like musculoskeletal health, there are no standards. There is no like set. Do this. Do this. It's a trial and error process. Everyone responds differently,
and all clinicians are different.
All clinicians
you may go to 10
too.
different people and have 10 different things to do that first day.
Yeah.
And just because you're a little bit worse after that first day does not necessarily mean, well, that was terrible. They're stupid. Let's just throw in the towel. The PT or the chiropractor didn't work for me because I went one time.
Yeah.
It was all a part of the assessment process to know what is going to probably work and what's not going to work. We can then move to a different direction.
Yeah.
But we don't want to make anybody worse the first time. That's not our intention at all.
But if
but
it
occasionally
does,
it happens.
Yeah, and if it does, like that just tells us, okay, that gives us more information. Now we can reassess the situation, and maybe that says, okay, if that doesn't work, then we need to do this
Probably
next.
the exact opposite.
Usually the exact opposite. So it's constant trial and error. Just because you worsen with one thing doesn't mean that you're going to get worse overall. It just means you need to tell your provider that. And then as providers, we need to take that information, understand that, okay, maybe this isn't the best movement, the best exercise, the best strategy. Let's go this route instead. So if you feel like you have failed chiropractic or failed physical therapy or whatever it may be, I would...
And have only been to one practitioner, or maybe, or you tried it for, a few weeks, and I was like, well, no, that didn't work. I guess I'm going to, gonna say that I failed it, and I'm going to go to a different... level or whatever. Yeah. You can, but you could also try, to do some research, ask some people, do some, look up some reviews online, try to figure out who may be able to help me with this problem that I have, that maybe does it a different way. We've had plenty of people who have come in here that have failed other places and improved. Lots. And I'm sure I have also had many people who have come to me and wasn't able to help them, and they went someplace else and got helped.
Yeah.
It just is, we just didn't have the right, at the time, whatever it was, it could even just be sometimes timing that the day they came in, where they were at on a sensitivity or acute, scale, maybe those movements weren't appropriate at that time. And then maybe 2 weeks later, a month later, when they try somebody else, it is appropriate. I've had that happen with people that I help online. They've done a movement in the past that said, oh no, that's worse. That's where I didn't like that one. That one may be worse. Okay, try it just because I haven't seen it. Try it for me. Oh, that now makes me feel better.
Yeah.
I didn't do anything special. It could just be timing sometimes.
It could be the relationship to your doctor too. Like maybe you come and see me and you don't like me for whatever reason, but you go and see Chris and you love Chris. Okay, you're going to get better results with Chris than you would with me just because you like Chris better.
Right, and that's part of that too is just mental believing in someone and believing, saying, okay, I feel this person this clinician, he or she can, like, I believe they can help me. I think I can get better with this person. You're more likely to get better. That's bottom line.
100%.
I mean, and if you go into the appointment, into the visit saying, I don't think I'm going to get better there. I think I have the worst thing ever, and I don't think what they do is going to help me. You're probably not going to get better.
Start, yeah.
Even if they do everything correctly, you're probably not going to get better.
Yeah. So recapping here, the inflammatory process is natural and it needs to happen. You can take meds as needed to knock off the pain, but you need to let
Chemical
that
for a
inflare.
chemical,
Yeah, chemical
mechanical
for
for
chemical.
mechanical.
Yeah, you need to let that thing play its course. You need to have a good relationship with your doctor, and don't think you failed care just because you had a worsening. Tell your provider so they can readjust or reassess the entire situation and try to give you the next therapeutic.
Or you may need to go somewhere else.
Yeah, or go somewhere else. Yeah. If you have any questions, comments, concerns, anything, back, spine, neck, knees, hips, ankles, shoulders, whatever, we
Let us know.
answer
a
it all.
line.
Yeah. Let us know and we'll answer your questions. And if you have any specific things you want to see a video on, comment below and we can make that happen for you. So
Thank you very much.
see you next time.